So now I'm going to do maintenance for laboratory equipment. The machine that I've chose to do maintenance on is going to be our ProSite. So our IDEX ProSite, which is the CVC machine. The first thing I'm going to do is going to be the quality control. So what I'm going to do is on the vet lab station, I'm going to go to instruments, I'm going to click the ProSite, I'm going to go to quality control, and I'm going to do add quality control lot. So I have a scanner, so I'm going to do the barcodes. So either that or you have to type in the whole number. So for the first barcode, and then the next barcode, okay, so now that the barcodes are scanned, I'm going to push next, and then I'm going to push the quality control lot that we're going to use, and then I'm going to run the quality control. Okay, so it says to warm it to temperature for 15 minutes. I've already done that, and then I'm going to gently invert it for about 10 inverts to make sure that it is not thick on the bottom. I'm going to push next. So now I am going to load the quality control into the CVC machine, and then I'm going to push OK to start it. Okay, and then I'm going to push this button, and then it's going to run the quality control. Okay, so now I'm going to perform the monthly rinse on the IDEX ProSite machine, which is the CVC machine. I am going to click instruments on the vet lab station. I'm going to do the ProSite instrument, and then I'm going to do diagnostics, and then I'm going to look for monthly rinse. And so I'm going to click monthly rinse. This one, it gives you the option of the 2 ml of the HydroClean or 5% bleach solution. I've already made a bleach solution, so I am going to put bleach solution in an untreated container. I'm going to push on here the start button, and now it's going to do its monthly rinse. So the next maintenance that we're going to do for the ProSite is going to be turning off the analyzer. This should be done once a week. So I am going to go to instruments, I'm going to go to the ProSite, and then I'm going to turn off the ProSite. Okay, so it says it's going to take about 3 minutes to turn off. At that point, we are going to clean the analyzer. So to do this, you want it off, and then I'm going to open up this side door right here. I'm going to clean down the inside with damp, lint-free cloth. Not wet or soaked, but definitely damp. So I'm going to clean outside of the analyzer with this cloth. So the analyzer is going to be right over here, and so I'm just going to get all of this blood residue out of here. So I'm going to very gently clean it off. If it's very greasy, you can use a very mild detergent. I'm being careful not to touch the actual analyzer. So I'm just going to close it up and turn the machine back on. Okay, so now we're going to request a heartworm test for this patient. So I'm going to go to the description box, push F2. I'm going to start typing in heartworm test until it comes up, and then I'm going to double click and then push done. So now we are going to do a canine antigen heartworm test. And so the equipment I'm going to need is going to be the actual heartworm test, the conjugate, one of these little tubes, this just to put the tube in, and then I have some heparized blood right here. So what I'm going to do is I'm going to prepare the sample. So I am going to do 4 drops of the conjugate. I'm going to do 3 drops of blood in this little silver bag. It's going to have a pipette, and I am going to put the blood into the pipette and then drop it into this little test tube. And then I'm going to gently invert the test tube about 10 times to make sure that it is thoroughly mixed. And then I'm going to place it into the snap test, into this little well, and then once this area right here gets filled with blood, I'm going to snap it down. Now this is full with blood, and I'm going to snap it all the way down. I'm going to set the timer for 8 minutes, and then it's going to be ready to be read. The timer for 8 minutes is up, and so now we can read the results of our heartworm antigen test. Full is blue, but then there are no dots on either side, so this PET is negative for heartworm antigen. Okay, so now we're going to do a modified knots test. The reasons for doing this would be to concentrate microfilaria and lyse red blood cells. It's also good for differentiating between diofilaria and acanthochylomema. The supplies you'll need for a modified knots test is going to be 1 ml of whole blood. You're going to need methylene blue. You're also going to need a slide, a cover slip, and a pipette, as well as a test tube, and then 9 ml of 2% formalin. So the first step is going to be adding 1 ml of whole blood into the test tube. And then I'm going to add 9 ml of the 2% formalin into the test tube. I'm going to thoroughly mix the blood and the formalin by using the pipette. Okay, so now I'm going to centrifuge the formalin blood mixture for 5 minutes at 1,500 rotations per minute. So the centrifuge has finished spinning. So now I'm going to remove the supernatant and being careful not to disrupt the pellet at the bottom. After that, I put in 1 drop of methylene blue. And then I'm going to use my pipette to mix it up. After that, I'm going to take 1 drop of the solution and place it on my microscope slide. And then I'm going to cover it with a cover slip. And then it's going to be read at 100 and 400 magnification. Okay, so first we're going to look at the slide under 100 magnification. Okay, this dog at this magnification is negative for microfilaria. And under 400 magnification, you can see the ghost cells, the lyse red blood cells. Okay, now for our first fecal testing method we do is going to be a direct smear. Benefits of doing a direct smear are that it doesn't require a lot of equipment, it doesn't take a lot of time, and you can get a pretty quick reading for parasites and bacteria. The downside is that it's not a lot of fecal that's being examined, so it's a very small amount that you're looking at, so parasites can be missed, especially if it's not a large burden of parasites. To get started, I'm going to put a drop of saline onto the slide. I'm going to show you that. So just 1 drop. Okay. And then I'm going to stick the back of the Q-tip into the stool. And you don't need a lot of stool. And then on the slide, I'm going to mix it in there. You don't want it too thick, you just want it a nice, even amount. It says to be able to read through a newspaper with, so it's not too thick. And then I'm going to put my cover slip on. And then it's ready to be read at 100 and 400 magnification. Results for the fecal testing, the direct smear, there were no apparent parasites. The second fecal testing method we're going to do is going to be simple flotation. What we're going to do is I'm going to scoop approximately 2 grams of stool into this little plastic cup. I'm going to fill part of the cup up with my fecal solution, and I'm going to mix it up very well. After that, I'm going to strain it. I'm actually going to strain it into another one and then pour it into a test tube because I find that much easier. So now it is strained of the big chunks of fecal material, and now I'm going to pour it into the test tube. Okay, I'm not going to pour it all the way over because you don't want to overfill it. So what I'm going to do is I'm going to gently pour a little bit more of the fecal solution into the test tube just to a meniscus forms. Okay, so now this is going to sit after I put the cover slip on for 10 to 15 minutes. At that point, I'm going to remove the cover slip and put it on a microscope slide, and then I'm going to read it at 100 and 400 magnification. The issues with the simple flotation is that fluke ova are heavier, so they won't float to the top, and the fecal solution can distort the larvae and crenate them and make them hard to recognize. The benefits is that minimum equipment is needed, you don't need a centrifuge, and it does not take very much time. The results for the simple flotation for the fecal testing was positive for Toxicara canis, which is roundworms. The next fecal testing method that I'm going to be doing is going to be a sedimentation. Sedimentations are primarily done for large animal feces looking for fluke eggs. Fluke eggs are heavy, so they do not float during flotations. The issue with the sedimentation is that it takes a while, and then the eggs can be hidden by the large amount of debris. To start off, I'm going to put about 2 grams of feces into a little plastic container. So now that I have the feces into a cup, what I'm going to do is I'm going to put tap water into it, and then I'm going to mix it. So I'm going to thoroughly mix it. I'm going to break up all the large pieces of stool. Once they are all broken up, what I'm going to do is I'm going to pour it into this through the strainer to strain it. This is going to stop all the large pieces of fecal from going into it. After that, I'm going to pour it into my tube. So either you can let it sit for 30 minutes and then it will all sink to the bottom, or you can centrifuge it for 5 minutes. I'm going to centrifuge my tube with the counterweight for 5 minutes. It's been 5 minutes and the centrifuge is done. So next I'm going to pipette off the supernatant. You can see the 3 distinct layers in this sample. So it's a little bit harder to see since it's a fixed angle centrifuge, so it ended up being a little bit sideways. You can see the top layer here, the middle layer here, and then the bottom layer. So I'm going to take samples from each one of them. I have all of my slides already labeled and ready to go, as well as my cover slips. So I'm going to gently take some of the top layer. I'm going to gently take some out of the middle layer. I'm going to get some from that bottom layer. And now I'm going to read all of them, and I'll give the results after. The results for the sedimentation were positive for Toxocara canis, which is roundworms. So the next fecal testing method that we're going to do is going to be a fecal float with centrifugation. To start off, for the fecal float for centrifugation, it's going to be about the same as what you do for a normal fecal float. So I have 2 grams of stool into a cup. I'm going to fill the cup up partially with the fecal solution, and then I'm going to thoroughly break up and mix the stool with the fecal solution. After you've thoroughly mixed the stool with the fecal solution, you are going to strain it into this cup. So now all of the thick fecal particles have been removed. After that, you are going to pour the stool into the tube. I'm going to fill it up a little bit more, but I don't have to fill it all the way to the top because it is a fixed angle centrifuge. If I fill it all the way up, it's just going to spill over. I'm going to centrifuge the sample for 5 minutes. The centrifuge has finished spinning. Now that the centrifuge has quit spinning, instead of filling it up to a meniscus and letting it sit for 10-15 minutes, I have a bacterial loop. So I am going to put the bacterial loop just at the top level of this solution, and then I'm going to dab it onto my microscope slide. And then it's going to go onto my microscope slide, and then I'm going to place a cover slip, and then I'm going to read the slide at 100 to 400 magnification. The results for the centrifugation with flotation was negative for parasites. An ear cytology would be performed when an animal comes in presenting problems of itchiness of the ears, redness, swelling, ebullient or excessive discharge, and shaking of the head. Both ears are always checked, even if one is not presenting symptoms. So now we are going to do an ear swab on a dog for an ear cytology. The equipment you're going to need is going to be 2 ear Q-tips. I have a slide, which I'm going to rub the ear cytology on, and then I also have sterile saline, which I've already pre-moistened my Q-tips with. I'm using the saline because when you use the saline, it damages less of the cells when you take the cytologies. So the first ear I'm going to do is going to be the right ear, and so to do this, you're going to hold the dog's pinna, and then you're going to put the Q-tip into the ear canal. You want to do the vertical ear canal. You don't want to go too deep, because if you get into the horizontal ear canal, there's a chance that you can damage the tympanic membrane. So I have the ear pinna, so I'm going to just go into the ear canal and just kind of get in there gently. Oh, that is nice. And then I'm going to take my slide and I'm going to gently roll the swab on the slide. Okay, so that was the right side. Okay, so now I'm going to do the left side. I'm going to do the exact same thing, just into the ear canal. And just get on the inside of it. Make sure I rub those walls. And then on the same slide, well, first I'm going to break the end of the Q-tip, and this is done to distinguish the left from the right. At this clinic, to do the on the microscope slide, they actually roll it in the shape of an L to help differentiate when you're looking under the microscope. So we have our ear cytology sample. The first thing you're going to do, especially if there's a lot of wax on the sample, is to run a lighter underneath or Bunsen burner flame. So you want to do it very quickly. You don't want to do excess heat. Excess heat can break down the cellular components, but just a little bit of heat will help melt the wax and make it easier to read. Then I'm going to wipe the back of it with a Kim wipe, and it's ready to stain. So now I'm going to stain the ear cytology for Buddha. So I have our dirty diff quick, so we have the clean and the dirty, and we are going to use the dirty one for ear cytologies. I'm going to put the slide first into the fixative for 1 minute. It's been 1 minute, so I'm going to remove the slide from the fixative. I am going to rinse it with distilled water. Make sure to rinse the back of the slide. And then I'm going to put it in the stain solution for 30 seconds. It's been 30 seconds in the stain solution, so I'm going to remove the slide and rinse it with distilled water. I am then going to put it in the counter stain for another 30 seconds. It's been 30 seconds, so now I'm going to remove the slide from the counter stain and I'm going to rinse it with distilled water. Okay, and then I'm going to let it dry. So now that the ear cytology is stained, we are going to look under the microscope at it. First, we are going to look at 100 magnification, and we are going to look for ear mites. There are no external parasites to be seen. After that, I am going to move to 1000 magnification. And for this, I am going to place a drop of immersion oil. And I'm going to look for bacteria and fungus. On the left side, there is rare cocci. The right side is 2+ cocci. Now I'm going to demonstrate the proper method of collection, preparation, and evaluation of dermatologic and fungal testing. Various methods of collection would be using cellophane tape and using forceps. The indications for testing would be itchiness after parasites and allergies have been ruled out, and we would be looking for broken hair shafts, dry scale, redness, and lesions. The main fungus that is encountered in veterinary clinics would be Microsporum, which is different species of ringworm. So particularly we'd be looking for circular red lesions. So the area that you would pick to take collection of sample from would be the periphery of the suspected lesions around the broken hair shafts and dry scale. You don't want to do specifically on the lesions, but right where lesions meet the skin that is unaffected. So now we are going to do fungal testing. The fungal testing medium I have is a DTM, so that's a dermatophyte test media. I also have, for supplies, I have sterile forceps. So what I'm going to be looking for normally in a dog would be lesions, redness, alopecia, anything like that. So now I'm going to take a few samples about mid-shaft on the hairline. So if the lesions were here, I would take a couple right here, making sure that the sterile forceps stay as sterile as possible. And I'm going to put it into the media, and I'm going to gently push into the media. I'm going to take a couple more samples and put it into the media. So now that I have gotten my fungal samples and I've pressed them into the DTM, I'm going to put the cap on, but I'm going to make sure that it is loosely put on. So this is going to be monitored every day, so every 24 hours. And at the slightest change of color to red, I'm going to check it that day with a cellophane tape, and I'm going to look for any fungus. So no apparent change in the color of the DTM, but there is slight fungal growth. You can see it right there in the center. So I am going to take some cellophane tape, and I'm going to press it onto here and then put it onto a microscope slide to read it and look to see if it is just contamination or if it is microsporum. So I have my DTM sample, and then I have a strip of cellophane tape. I'm going to take the tape and press it into the DTM. And then I'm going to put this onto my microscope slide. And then I'm going to read it first at 100 magnification. At this time, the DTM is negative for microsporum fungal growth. So now we are going to discuss the proper method of collection, preparation, and evaluation for dermatologic testing. Today we are going to go over the skin scraping. So the indications for skin scraping would be itchiness, redness, and lesions of the skin after external parasites, as well as allergies have been ruled out. Just like during the fungal testing, the area to be collected from would be the interface of the affected and the unaffected area of the skin. So right where any redness and lesions and scaling meets a normal skin. So now we are going to do a skin scraping. So the equipment you're going to need is going to be a 40 blade, a microscope slide, a 10 blade for a scalpel blade, and mineral oil, as well as a cover slip. So first what I'm going to do is I'm going to prepare the spot to be scraped. So I'm just going to shave a very small area at where the lesion is, where we're looking for the mites. And this is just going to reduce some of the surface contaminants. Then I'm going to prepare the slide. And to prepare the slide, I am going to put a drop of mineral oil onto the slide. And then before I scrape the skin, I am going to dip the scalpel blade into the mineral oil to prepare the scalpel blade. So the different mites you are looking at are going to be, if we are doing a superficial scraping, we're going to be looking for Calytella. And if we are going to be doing deeper skin scraping, we're going to be looking for either tunneling Sarcoptes mites, or we're going to looking for Demodex, which would be in the hair follicle. So it is very important when you do the skin scraping to make sure that the blade stays horizontal with the skin, so parallel with the skin. If you do any perpendicular motions or anything like that, you can very easily cut into the skin and cut into the muscle. So I'm going to prepare the scalpel blade by putting it into the mineral oil, and then I'm going to very gently scrape the skin where I shaved it off, making sure to keep that blade parallel with the skin. So to do superficial scraping, you're just going to find wherever it has any flakes or anything, and you're just going to scrape on the flakes and the crust just to get those lesions, because that's where the superficial mites are going to stay. To do the deeper skin scraping, you're going to scrape until you see capillary blood, and then you're going to scrape just a little bit more, and that's where the demodex and sarcoptes would be. So I'm going to do a deep scraping. So I'm going to scrape just until I see some capillary blood. I'm going to squeeze it, and I'm going to do one more scrape. And then I'm going to take my scalpel blade and the front side of it, the side that I scraped with, I'm just going to press it and scrape it onto the slide. After that, I'm going to put on a cover slip, and this is ready to be read. So now I'm going to microscopically evaluate the skin scraping. So I'm going to set the microscope slide to be evaluated at 10x, so 100 magnification, and I'm going to search the entire slide, and I'm going to look for the superficial mites. So this sample is negative for any superficial mites. The equipment we are going to use for the necropsy is going to be a blade holder, a 10 blade. I have 2 different kinds of scissors, 2 different sizes, a couple hemostats. I have formalin jars, and then I'm going to have the personal protective equipment for the doctor, myself, as well as the person taking the video. So I have my apron, I have a mask, and I have gloves. So now we're going to do a necropsy. The purpose of doing a necropsy would be looking for disease and parasites post-mortem.
The veterinarian going to conduct the exam today, and we're presented with a mature adult male rat that has been humanely euthanized. So first thing is to do a thorough examination from head to tail, looking to see if there's any diseases of the eyes, any injuries to the head or the ears. We're looking for wounds, we're looking for tumors, we're looking for parasites. We can open the mouth and see if there's any bleeding. We can see if there's any change to the color of the gums. An exam of the skin should be performed to see if there's any external parasites, to see if there's any skin lesions, and to evaluate the body condition of the subject. This rat was well fed, is in good flesh. There's no obvious bruises or cuts or scrapes, no tumors. We're going to examine the chest cavity and the abdominal cavity. We're going to make a midline incision starting from the xiphoid process, extending down to the pubis. We go through the skin and through the abdominal muscles, and we're going to evaluate if there's ingesta, if there's food in the stomach, and in this case there is. There's no foreign objects. We don't feel any tumors. We don't feel any disease. We can see the spleen right behind the greater curvature of the stomach, and we're looking also for signs of infarcts or trauma or other gross lesions. None are present. And we'll work our way down through all the intestines. This is all normal viscera. The kidney is this purplish bean-shaped structure. We have one on the left and we have one on the right. They're both normal. And above those we have adrenal glands, both normal. We're looking for masses, we're looking for infarcts, we're looking for infection, we're looking for parasites. We'll open up the chest cavity. Lungs are normally pink and light and inflated, resting on either side of the heart. And the heart is the largest structure within the chest cavity. And if it was larger, we'd probably do a more thorough examination of the heart and open up all of the chambers. We'll send the heart off to the lab, and maybe the laboratory can take a look at this. So I'm going to carefully pass off this specimen to my assistant and place it in formalin.
So we have our formalin jar, 10% formalin, that is correctly labeled. It has the patient's name, it has the hospital, the date of the necropsy, and that it is a necropsy.
We'll get specimens of liver and kidney as well. I've taken my specimen of liver and I'm going to hand it off to my assistant.
And this jar is also labeled correctly.
So the left kidney, we're going to open up longitudinally.
For rabies suspect handling, only veterinary staff that have had rabies vaccines priorly and have a serum titer of 1 to 5 can handle potential rabies suspects. Protective gear to handle rabies suspect is going to be goggles, double thick gloves, as well as a protective mask. The specimen to be submitted to the lab is going to be the head. Sever the head at where the atlas meets the magnum foramen. Primarily, the head is sent in on domestic animals to a laboratory the day of. In Florida, the specific guidelines and policies, especially since it is so hot and humid, is for it to be sent in as soon as possible. The policy is to double bag the head in a thick plastic bag and then to be put into a styrofoam container with ice packs. It is not recommended to do dry ice because then it can freeze the specimen. For small domestic or wild animals such as bats, the entire body can be transported. Anything smaller than a squirrel can be sent in the same container, but all of the specimens need to be separate in double bags and specifically labeled with details about why they were sent in for rabies prep, so bite reports and everything. The remainder of the body of the rabies suspect is to be double bagged in a thick plastic bio-waste hazard bags. They are to be disposed as biological waste. So for the vaginal cytology, you are going to need some Chlorhex scrub. I have sterile Q-tips. They have been autoclaved. I have saline to moisten the Q-tips, as well as a slide. Okay, so the technician is going to clean the vulva with the chlorhexidine scrub. Once the vulva is clean, we are going to be sure to not let the tail drop back down and get the vulva dirty. So I have the sterile Q-tip, and I am going to moisten it with the sterile saline. Okay, this is going to reduce cellular damage. In insertion, you are going to do at a vertical angle until you get to the vaginal canal, and then it is going to be horizontal. She's going to gently roll it in the vaginal canal, and then once we remove it, I am gently going to roll it onto the slide, and then we're going to go stain it. So to stain the vaginal cytology, first I'm going to put it in the fixative solution for 60 seconds. It's been 60 seconds, so I'm going to remove the slide, and then I am going to rinse it with distilled water on the backside. And then I'm going to put it in the stain solution for 30 seconds. It's been 30 seconds, so I'm going to rinse the slide again with distilled water. And I'm going to put it in the counter stain for 30 more seconds. It's been 30 seconds, so I'm going to remove the slide from the counter stain, and I'm going to rinse it with distilled water. And then I'm going to let it dry, and then it'll be ready to be read. The slide is dry and it's ready to be read. First, I'm going to look at it at 40 magnification, and then oil immersion 1000 magnification. 1000 magnification, oil immersion. So what I am seeing is going to be non-cornified squamous epithelial cells. There are no red blood cells. I have seen a few neutrophils, but not many. The dog has had no history of estrus, so I'm determining that this dog with lack of vulvar swelling and vulvar discharge, the dog is in anestrus currently. The 4 stages of estrus are going to be anestrus, proestrus, estrus, and metaestrus or diestrus. So anestrus, the female dog is not going to have any vulvar swelling, any discharge, and is not going to accept intact males that want to breed. Microscopically, the cells are going to be basal, parabasal, or intermediate squamous epithelial cells, and they are going to be non-cornified. There are going to be little to no red blood cells. Anestrus is going to last about 4.5 months on average. Small breeds tend to have more frequent breeding cycles, while larger breeds can be up to 18 months between each estrus cycle. So proestrus is going to last about 9 days. The dog is going to have vulvar swelling as well as reddish vulvar discharge. It will attract male dogs, but it will not breed. Beginning of proestrus, the neutrophils are going to start to decrease, and there's going to be a high number of red blood cells. About midway through estrus, the red blood cells are going to decrease, and you're going to see slight cornification of the epithelial cells, and by the end of estrus, you're going to see little to no red blood cells, and most of the cells are going to be intermediate parabasal cells with the pycnotic nuclei. So for estrus, the vulva is still going to be swollen, and there's going to be a pinkish to straw colored discharge. The female will accept intact males during this time, and it's going to last about 9 days. Microscopically, you're going to see the squamous cells cornified. You're going to see very little neutrophils until the end of estrus, and very low numbers of red blood cells. Metaestrus or diestrus is determined by history of estrus. So you'd see a decrease in swelling of the vulva as well as a decrease in discharge, and the female dog is not going to allow male dogs to mount her. Microscopically, it is going to be very, very hard to distinguish from anestrus, and you're going to need that clinical history of estrus to determine the difference. So you're going to see the parabasal cells, basal cells, intermediate cells. The cells are going to be non-cornified, and you're also going to see a decent amount of cytological debris. At the beginning of the metaestrus or diestrus, you're going to see a large number of neutrophils, but that's going to decrease over time, and then you're going to see little to no red blood cells. The diestrus is going to last 2 to 3 months. So now I'm going to be doing a cross-match agglutination test. It is normally done to check to see if 2 animals are compatible if they have blood transfusions. I have drawn the blood from 2 animals, and so I have both of the donor and the recipient blood in 2 purple EDTA tubes, and then 2 tiger tubes. Okay, so I'm going to centrifuge both the donor and the recipient's tiger top and lavender top tubes for 10 minutes. Now that the tiger top tubes and the lavender top tubes are spun down, they are ready to have the serum and the plasma pipetted off. Now I'm going to wash the erythrocytes. So to do this, I'm going to get a clean pipette and I am going to put 2 drops of blood into a labeled tube. So this is going to be the donor erythrocytes. I'm going to put the pipette in and I'm going to go to the bottom. I'm going to put 2 drops of red blood cells into a labeled test tube. And then I'm also going to do the same thing for the recipient's red blood cells. So now what I'm going to do is I'm going to fill both of these labeled tubes, the ones I just put the 2 drops of blood into, I'm going to fill them both with the 9% saline. Now they are going to be gently mixed. I'm going to do this by flicking them very gently. And now they're going to be centrifuged, both of them, for 1 minute. Okay, so to centrifuge the erythrocyte wash, we're going to put them both in to counterweight each other, and then they're going to spin for 1 minute at 3,400 rotations per minute. Okay, so now the supernatant is going to be removed. And I'm getting a different pipette for the recipient's wash. I'm doing it with a pipette because then it doesn't disturb the blood pellet at the bottom. Okay, so now both of these are going to be filled up again with 0.9 saline. And now they are going to be centrifuged again after I mix them. I'm going to centrifuge both the donor and recipient wash again for 1 minute at 3,400 rotations per minute. The centrifuge has stopped spinning again for the second wash, so I'm going to remove the test tubes. And then again, I'm going to pipette off the supernatant and leave the pellet undisturbed on the bottom. Okay, undisturbed pellet. Okay, for the third wash, I'm going to again fill up the test tubes with saline. Both of them are going to be gently mixed. And now I'm going to centrifuge both of them again for 1 minute at 3,400 rotations per minute. So the centrifuge is now done, so the erythrocytes are officially washed. You can see that the supernatant is very, very clear. What I'm going to do now is again remove the supernatant. Okay, and I'm removing the supernatant from the recipient wash. Now that the erythrocytes are washed, I'm going to make a suspension. So this is the recipient wash, so I'm going to use a 1 ml syringe. I have a 18 gauge needle on this just so it doesn't damage the erythrocytes. And I'm going to take 2 mils of the erythrocytes and I'm going to mix it with 0.98 mils of saline, and that's going to make the 2% erythrocyte suspension. 2% is going to go into my labeled anthracite wash for the recipient. Okay, and so then I'm going to put in also my 0.98 mils of saline. And so what I'm going to do is I'm actually going to take some of the saline mixture back up in here just to get all of those anthracites out of the syringe. Okay, and so for the donor anthracites, I'm going to do the same thing. I'm going to draw up 0.2 mils into my syringe. So 0.2 mils of the anthracite wash, and it's going to go into the donor anthracite suspension test tube. It's going to have 0.98 mils of saline added. And then I'm going to get the rest of the anthracites out of the syringe. Now that I've completed washing the anthracites and making my suspensions for the donor and the recipient, I am going to do both a donor and a recipient control, and then also a major and minor cross-match to check for agglutination. For the donor control, I'm going to do 2 drops of serum, so donor serum, into the donor control, which is labeled. And then I'm going to do 2 drops of the donor suspension. Okay, and then for the recipient's control, I'm going to do 2 drops of recipient serum. I'm also going to do 2 drops of the donor's anthracite wash. So now that I've set up both the donor control and the recipient control, I'm going to do the major and minor cross-match. For the major cross-match, I have this tube labeled. The major cross-match gets the recipient serum and the donor's anthracite wash. So I'm going to do 2 drops of serum, 2 drops of anthracite wash. So anthracite wash for the donor, 2 drops. 2 drops of the recipient's serum. And I'm going to gently mix it. And then for the minor cross-match, it's going to be the 2 drops of the donor serum and 2 drops of the recipient anthracite wash. So recipient anthracite wash, labeled, 2 drops, and 2 drops of the donor serum. So donor serum. One, 2. Okay, so I'm going to do a gentle mix. And gentle mixes for both my controls. And then these are all going to incubate for 30 minutes. Okay, so it's been 30 minutes, so now I'm going to centrifuge both the donor and recipient control as well as the major and minor cross-match for 1 minute at 3,400 rotations per minute. The centrifuge has stopped spinning, so now I'm going to remove the test tubes. We are going to check for hemolysis. You determine hemolysis by the red tint in the supranatant, but they all look very clear, as well as the major and minor cross-match. Now I'm going to check for macroscopic agglutination of the donor control by mixing it. So I'm going to mix it pretty thoroughly by flicking the two. Okay, so it doesn't look agglutinated macroscopically. We're going to check the recipient control. And no agglutination macroscopically for the recipient control. For the major cross-match, there is no apparent agglutination. And let's check the minor cross-match. I cannot see any agglutination. Now what I'm going to do to double check to make sure there is no agglutination is I am going to put drops of all of my test tubes. So I'm going to do the donor control, the recipient control, major and minor cross-match to check for microscopic agglutination. So all of my slides are already labeled. So first is going to be the donor control. I'm going to take a drop, place it on the slide, and cover it with the cover slip. Okay, so now I'm going to check microscopically for agglutination. I am going to lower the condenser to increase the contrast, and then I'm going to look under the microscope at a low power. Okay, so there is, of the donor control, no visible agglutination, and the red blood cells are evenly dispersed. Okay, so now I'm going to be looking at the recipient control, and it looks like the red blood cells are not clumping together and are evenly dispersed. So the major cross-match, no apparent agglutination, and the red blood cells are evenly dispersed. In the minor cross-match, there is a little bit of agglutination. It is not a large amount, the erythrocytes are evenly spaced out, but there is agglutination, so I'm going to say that these dogs are not compatible for a blood transfusion.